Hi, I'm Rebecca.
And I'm Trisha.
And today we're going to talk to you guys about the PLS-5 screeners.
If you're looking for the PLS-5 screeners in the clinic, this is what they look like.
The PLS-5 screeners assess 4 different areas, and these 4 areas are auditory comprehension, expressive communication, social and interpersonal communication, and feeding and swallowing.
The PLS-5 screeners are standardized norm reference assessments.
Administering the PLS-5 screeners involves the examiner interacting with the client and the client verbally responding to stimulus pictures.
Administering the PLS-5 screeners only takes about 5 to 10 minutes, which makes it super quick and easy.
The purpose of the PLS-5 screeners is to screen participants and determine whether they should be referred for speech and/or language assessment.
There are several PLS-5 screener subtests, including connected speech, fluency, language, voice, articulation, social and interpersonal, as well as feeding.
The PLS-5 screener comes in an English version and a Spanish version. The age range for the English version is birth to 7 years and 11 months, and the age range for the Spanish version is birth to 6 years and 11 months.
The material list includes the assessment manual, record forms, and manipulatives such as keys, toys, or even bubbles.
Now for some normative data. The English version of the screener was standardized on 1,400 children, and this standardization was done from January 2010 through September 2010. The children that were a part of the sample were between the ages of 0 and 7 years and 11 months, and the sample included 1,302 non-clinical children and 134 clinical children. This sample was directly compared to the 2008 U.S. Census and reflects similar demographics. Now for the Spanish screener, that normative data was collected between May 2010 and March 2011. The sample included 1,150 children between the ages of 0 and 7 years and 11 months, and it included 1,084 non-clinical children and 96 clinical children. The data was collected by 111 examiners in 18 different states and Puerto Rico. The normative sample was stratified based on race and ethnicity, sex, age, primary caregiver's country of origin/descent, primary caregiver's education level, and region.
As far as pricing goes, the English kit is listed at $222.50. The Spanish kit for ages 0 to 3 and 3 to 6 are both listed at $131.30. A kit includes a stimulus book and test manual with administration and scoring directions, stimulus pages, technical information, and 25 record forms for each age. Please note that there's a record form for each age, and each replacement set is about $50 for 25 copies.
When calculating the child's chronological age, you subtract their birth date from the test date, and you do not round this number up.
When it comes to starting and ending, use the test appropriate for the child's chronological age and administer the screener from beginning to end. For both English and Spanish, once the pass criterion has been met in the language section, it is not required to administer the remainder of the test.
When administering the PLS-5 screener, you should follow these instructions. First, caregiver participation is encouraged, especially when working with toddlers and infants. Second, you should administer the test that is appropriate for the child's chronological age. Directions and stimuli can be found in the stimulus section for each age group. Lastly, when you complete the screener, you should fill out the screening summary table at the end of the record form. When administering the screener to Spanish-speaking children, it is important to remember that the vocabulary can be different depending on the child's country of origin and regional linguistic variations. Examples of different correct responses and alternative vocabulary can be found in the stimulus section of the manual.
If the child wasn't attending, you're allowed to repeat the directions or item stimulus slowly and clearly to allow the child time to process the information before responding.
If necessary, you can encourage the child to respond to an item within a reasonable amount of time, which is about 10 seconds.
Due to the short administration time, it is unlikely that a break will be needed. If the child becomes fatigued or frustrated, you may discontinue testing and complete it later. Note this on the record form.
The PLS-5 screener is scored manually with pass-fail scores. There's a different pass criterion for each section, and each section must be marked in the screening summary. In order to pass a section, the child must meet the criteria for the test item. If a child does not meet the criteria for a test item, additional information must be obtained. Calculate the child's score by totaling the score for each section. Each section notes the requirements for scoring. If the child's score meets the required criteria for a pass, the child has passed the section. If the child's score is below the criteria, the examiner should refer the child for complete articulation and voice evaluation.
The PLS-5 screeners are a convenient way to determine if a child needs an in-depth speech and/or language assessment in less than 10 minutes. Some concerns include the awkward seating arrangement, subjectivity of the test item scoring, and lack of dialectal difference reporting in the sample. The assessment's reliability and validity are up for debate. However, there are no other tests that target the same purpose and have avoided the same scrutiny. The PLS-5 Spanish screeners have resulted in similar commentaries. Criticism includes considering children who are bilingual in Spanish and languages other than English. There's extra importance in displaying clinical judgment when interpreting results. Our references are listed on this slide.
Thanks for watching!
We hope this helps.